Hello, my name is Dr. Colebank. I am a resident here at Washington Health System, UPMC Green. I also work at Mon Health Medical Center, where I do work in our labor and delivery department. And I'm a graduate of Albert Gallatin High School and a very close friend of Mrs. Cunningham. Mrs. Cunningham contacted me and said that you are studying deoxyribonucleic acid, or DNA. DNA is something that's very important for us doctors to understand. In the 1990s, we were able to sequence the entire human genome, and that was a project that really has advanced our understanding not only of medicine, but how we could form treatments of patients. One thing that's important that I do every single day is counseling with my patients on certain diseases that they could be at risk for. For example, if a patient has more than one relative that has breast cancer, or if a patient that has relatives that had breast cancer at a very young age, we can send them to a genetic counselor where they will sequence their DNA and see if they have a specific gene called the BRCA gene. Now, it's also my understanding that you're studying karyotypes, and that's also very important, able to match up the various different chromosomes that we have. One thing that we do now in karyotyping, as you will understand, is detecting trisomy 13, trisomy 18, trisomy 21, which you may know as Down syndrome. It wasn't as early as 10 years ago that doctors were screening for Down syndrome using ultrasounds. One of the many reasons why we take ultrasounds in the prenatal period. And the accuracy of that anatomy scan, what they would look at is what is called the crown rump length and the head circumference, was not much. The accuracy would be about 60 to 70%. If those would be positive, meaning that they would increase the likelihood that that baby has Down syndrome, they would move to a very invasive test called paracentesis, where they would go and actually get fluid from the amniotic sac in the mother, and they would test that fluid for certain hormones like estrogen, progesterone, alpha-beta protein. That again wasn't very accurate. It was about 80%. Now, just within, like I said, maybe 10 to 5 years now, we have discovered that we can take a little bit of the baby's DNA and karyotype it between the weeks of 12 to 16 in gestation. So very early, first trimester in the pregnancy, we can just take it from the mother, because at the placental level, the baby's capillaries and the mother's capillaries kind of interlock, and just a little bit of DNA is exchanged at that level. And we can sequence it just like the coronavirus PCR is sequenced over time, very quickly accurate, actually within a few days. And we can not only decide if this patient has a Down syndrome, Patau syndrome, Edwards syndrome, we can also just figure out what the baby's sex is that early. So there's a lot of utility with this. And you can think now that the future of medicine is truly genetics. There is a screening that we do once a baby is delivered for about 18 to 25 different genetic diseases that a baby can have, like cystic fibrosis or phenylketonuria are very common. And now just think of what we could do in the future. If we understand that a patient may be at risk for obesity, diabetes, high blood pressure, we could sequence their DNA as a child and determine, you're at risk for these diseases because of this genetic profile, and we can amend their life or start treatment even earlier. And then maybe the next thing that Mrs. Cunningham can talk about is maybe the future of genetics, where we can maybe even create gene therapies, immunotherapies, but that might be for something later. Today, I need your help. I have about 15 different babies here at the labor and delivery department. Don't worry, they're imaginary babies, but I'm gonna need you to help karyotype them for me so we can get them screened and send them home with their loving families. Well, here's signing off from Washington Health Green today, and I hope that you all have a wonderful classroom. You take care now. Goodbye.